So I'm Kusham Nijhar, and everyone calls me Kush. I'm an apprenticeship lead for the Thames Valley area, so obviously Bob, but also Frimley. My role was introduced about, I'd say, just over 2 years ago, because a lot of practices were trying to fight their way through the apprenticeship rules and funding, and taking on board especially the nursing associate trainee role, but then getting stuck when it came to the funding bit. And for that reason, and for many other reasons, the Southeast, what was then he, decided to pilot our roles across the Southeast. And I'm still here. So
you're doing a good job there. That's a very good sign. So thanks for that, because that really helps. So we're obviously from the primary care perspective. What are the apprenticeship roles that are available in primary care?
Okay, so I'm going to throw a question out to the audience. How many apprenticeships do you think there are nationally available?
Just in primary care?
No, nationally, for anybody in the country, any kind of apprenticeship. How many apprenticeships do you think are available? Lots. Go on, put a number to it. Come on. 15,000 apprenticeship. That would be amazing. That would be absolutely amazing. It's a lot less than that. 350, double that. Okay, so nationally there are nearly 700 apprenticeships available. You could be a golf greenkeeper, refrigerator maintenance, there's all sorts. Okay, in the NHS there are 350 roles, and there is an apprenticeship pathway for almost all of those. But for primary care, it can be really difficult to navigate from those 350. I have got a list. It's on our website. But typically, it is your trainee nursing associates, your registered degree nursing apprenticeships, management and leaderships, and we've got a couple of people in this room who are doing those programs. But what I've seen in slightly increasing, I think there's a movement towards digital apprenticeships, digital T levels, and everything around the digital space. And coming down the lines, we're going to see more of the clinical program, so advanced clinical practice, because currently a lot of people use the faculty funding to fund the degree route, but with the public purse string obviously being reduced all the time, if we've got this levy funding, why would we not go that way? So as more universities have an apprenticeship offer, we're going to see advanced clinical practice increase as well. Quality improvement is the other one. So if you think about CQC, we are beginning to see PCNs look at that. As you grow into your neighbourhood networks, in your merging, the whole thing around project management and change, there's definitely more interest there as well, because you've got a really good cohort of staff that you've employed from customer service admin who've grown with you, who understand your business, who would make for really good project managers. So there is quite a variety. At the moment, it's definitely around business and nursing, I would say, and management.
It's interesting you mentioned the digital T apprentice. What's that? What does that encompass?
So there's a few different digital apprenticeship programs. So it kind of spans level 3, where you've got your digital technician. So it might be somebody who's, maybe they are naturally good at your coding and your EMIS and your DocMans and whatever your different systems are. And actually you think, you know what, they would be really good at capturing that data and then analysing it, so that we can analyse, what is going on and what workforce we need. And so there's digital technicians through to level 4 digital data analysts, but there's also the business analyst. So the new role that's on ours, which is the digital transformation lead, there is a specific apprenticeship that the Practice Managers Association are using and then overlaying with primary care content, for example. And then, right through to level 6, level 7.
It's really interesting how, exactly as you say, it all ties back to you wouldn't necessarily think digital apprenticeship has, well, I wouldn't, got anything to do with population health, but actually that's exactly what it's doing. It's driving that population health need, so you can then choose what your services are that you provide for them. So it's actually using that data you've got and actually having someone in-house that can find it for you. So yeah, amazing. And another common question is, obviously it's quite a big ask, apprenticeships, we're going to go into the details of it. Is there evidence that if you do train someone as apprentice, that they stay in that practice or stay in that PCN?
If you do it well, definitely. I'm in a room full of people that are linked to HR today. So I want to hear from you. If you were to put 3 retention factors, what are they? Development, so developing your people. Yeah. What else? Pay. Teamwork. Yeah. Okay. And you know, if you treat your apprentice right, just like if you treat an employee right, they will stay. Now, nationally, I'm not going to lie to you. Okay, there's a reason I'm in this job and I'm always marketing. Apprenticeships is actually, it is a hard sell, because nationally the retention rate of apprentices is 50%. It's really dropped. It wasn't always this low, but it has dropped. And when you analyze and look at the reasons behind it, one of the reasons definitely is pay. If we are paying the minimum wage, okay, that's definitely not helping with retention at the moment, particularly for public sector, because you can go to Tesco, Sainsbury's, you know, there are the supermarkets, you know, but what, you know, if you're a young one and you want to do business admin, doesn't matter where you go, really, unless you're really passionate about healthcare. So there is competition around that, but much more importantly, it's how are you nurtured? What's the pastoral support? What's the variety in your job role? Does your employer want you to get a distinction? Are they going to help you towards that, if that is your ambition? You know, so in terms of stats locally, in Bob, I'm still working on what that retention rate is looking like with the nursing associate, but my best guess at the moment is about 80% in terms of the nursing associate role. In Frimley, we've now got 13 people that have qualified, and 12 of those are still in practice. Okay, one that left did go to a private healthcare side because she wanted to become a nurse. Her practice couldn't top her up onto the registered nurse degree, but I am seeing that movement happening now as well. So that's a brilliant retention rate, and on non-clinical it is about 85% as well. It's not easy. You do need to have your whole team. So you mentioned teamwork. It's no good just having one mentor, one supervisor and putting all the burden on that person. It's about looking at their skill set. So if they're doing a customer service apprenticeship, well, who is it in your business that understands your brand value? Because that's in the apprenticeship. Who is it that's really good at managing those conflicting situations? Who's a naturally good marketer? Because, you know, you can't think like marketing in our sector. Of course not. It's about how do you promote the care navigator role when you've got that person saying, why have I got to talk to you about, why can't I get to my GP? Well, who's naturally good at having that conversation with the patient? So buddy the apprentice up with those people who've got those different skill set. So we locally have a good retention rate because we've got a workforce that wants to stay working with us.
Drives it. It sounds like it's like with most things, what you put in is what you get out with apprenticeships. Okay, and that's interesting, just coming on that theme with the HR. So buddying up with different people sounds like a really good thing. Have you got any examples of how you've seen somebody, a practice or a PCN do that in practice, how they've buddied people up, just to give some ideas?
That's a really good question, and it's really going to get me thinking. I guess I'm not seeing it myself specifically, it is difficult, but it's always what I advocate for. I'm going to pick on Nargis right now because Nargis and I were talking about a senior leadership apprenticeship, and it was one of the things that, you know, we were kind of navigating, like, who would be your supervisor? And actually the conversation was, well, actually in your apprenticeship program you're going to be touching on finance and forecasting. You are obviously going to be looking at workforce, which is fine because you've got to do the HR side of things anyway. You will be looking at business strategy. So, you know, you wouldn't be going to just one partner, but actually that expertise might not exist within the practice as well. So in some PCNs, they are kind of asking about, right, where else can I go for this this mentoring, this expertise, because it doesn't always exist. Yeah, so you have to think creatively. But yeah, it's a really good question. Yeah, I can't give you one specific example.
That's a really good example, and actually thinking beyond your own PCN and sharing that knowledge, which is what the whole theme is for today. So yeah, that's amazing. Coming to kind of a beginning of an apprenticeship from an HR perspective, how do you onboard an apprentice with a PCN?
Okay, so I like to think in threes. Okay, so number one is think about your recruitment HR stuff. So what are you going to pay them? What's the local rate in your area? So how do you make sure you're going to be competitive? Are you going to go for a fixed term contract, or are you going to think about a permanent contract? And so when you're thinking about that, think about your age group that you want to target and the message you want to get across. Do you want somebody to come in for 18 to 24 months and then they've got that freedom to go because they're on a fixed term contract? Or actually, are you confident you're going to use your probation clauses and offer out a permanent contract because that's the intention that you're setting from the get-go? So, and then your job description. Yeah, so are they coming to you? They're not going to come to you on a standard job description already knowing stuff. They're here to learn. So flip your job description language. During these 18 months, you will learn to. In year one, you will learn to. In year two, you will do more of. Yeah, so really think about that and think about a career grading in terms of salary. So if you are starting a little bit lower, can you show that actually after 6 months or after a year, you might pay them that little bit more? So number one is your HR bits. Alongside that is number two, which is training provider. And don't, unless you've got a really good relationship with one particular provider, I always like to talk to 2 or 3, if not more sometimes, because you are in a relationship with this provider, this tutor, for 18 months, 30 months, you know, however long the program is. And so you really want to know that they do what they say they're going to do, first of all, that they have those regular meetings and check-ins with you as a manager or whoever the manager is for the apprentice. And if things start to go wrong, that you know that they're going to pick up that phone to you at an early stage rather than when it's too late because this provider's got too many apprentices to handle and they've dropped the ball. So it's really important that you work with a good quality training provider. And then the third thing is finances. Okay, so what are your different funding streams? Is it an R's role? Have you got access funds that you can use? Like thinking creatively around your budgets. Is it a vacancy that you can confidently convert into an apprenticeship? How are you going to pay for the apprenticeship training fees? They're under 18, it's free. There's some other caveats around that as well. But you know, if it's a nursing associate and it's £15,000, can you get a levy transfer? And alongside that bit, I'm going to throw in there, set up your DAS account, set up your apprenticeship service account. Even if right now you're thinking, I'm not going to have an apprentice anytime soon, doesn't matter. Just set up your apprenticeship service account because it can be a headache if you leave that too late. So 3 things: recruitment, training provider, finances.
As a complete novice, as I don't employ people, I'm going to ask a few questions on that. That's okay. So what is that account that you've just told me about? Yeah.
So it's I guess it's a government account. Technical term for it. It's you go onto the government portal, the government gateway, and you have a PAYE number. So as long as you've got a PAYE number, you enter those details in, and HMRC will do the background work and set up your account. Through that, they will know what your salary bill is. So as long as you are paying less than £3 million, you will be a non-levy payer, but you will have this account. So if we sit to the theme of you are a non-levy payer, which most PCNs, what will happen is when you add an apprentice to your account, so you've recruited an apprentice, you've got a training provider, you're then going to add those details. You're going to add your apprentice details, you're going to add your training provider details. The money will then flow through that system, so there's no invoicing. It also gives you the control to stop an apprentice. If they've not been working for whatever reason for more than 4 weeks, you can pause their apprenticeship. So that pauses the funding flow. If they've left, dismissed, or whatever it is, you can stop, and you stop the payments. Do it in collaboration with your training provider, because if they're owed money and you do it too soon, that's going to mess things up for them. But equally, if they've dropped ball and the money's still coming in, you know you've got that control.
Another idiot's guide question.
Yeah.
What's the levy? What's its levy?
It's a good question. So it's a tax, but it's a tax that you can draw back down, hence levy. So large employers pay this. They pay 0.5% of their salary goes towards their levy, but it's held in their money pot, and they can only use it for apprenticeships. So whether that's existing employees or they're bringing a new apprentice. But 25%, so for large employers, 25%, I think it is, of that funding pot can be transferred to us, the small employers, which is really, really helpful for us, you know, because on one side, sometimes they get pushback. So they say, Kush, it's £5,000 for a business admin. They only have to pay 5%. So that's what, £500? Got that right? £250, whatever that is. So, you know, just let them pay. Like, yeah, that's fine for one person. But actually, we want practices to do more of that. And when you then start layering that up, the money starts to add up, doesn't it? So that's basically what the levy is. So it's to draw that back down.
All right, thank you for that, my idiot's guide. I particularly liked how you utilise flipping your job descriptions, so you can set your expectations from an HR point of view. You will be at this stage at this point. That really helps. With the obviously, if you're releasing somebody to do some training, say you're a nurse apprentice, they're not in your practice that day, and for small employers, as you've said, actually not having that bod on the ground can have a big impact. Is there any means of backfilling that, or what? Do you know ways that practices are currently doing that?
There, but you know, I'm not going to sit here and say it's, you know, it's all fully funded, because it's not. There will be some impact on the budget, of course, and then we have to remember why we're investing in this in the first place, and it's because of that retention. So if you tried to recruit a nurse recently, I suspect many of you will have found it difficult to find a nurse who's got general practice experience, who is ready to hit the road running. So ultimately, this is what it's about. And when I first started out, there were practices saying to me, yeah, but Kush, this is going to cost us tens of thousands. We want to keep our HCA. We want to upskill her. We think she's fantastic. And we even know that she'll probably stay with us. She's probably our future nurse. But it's going to cost us into the tens of thousands. We worked it all out. But there is the £8,000, so it is £4,000 a year. But actually, there was I think it was called Traverse study. They did a research piece and they interviewed different practices. And actually, they found that not all practices are doing a like for like backfill cover. So do you need to cover the clinics in the same way that the HCA would have been doing? Is there a way that you can do? You know, look at the work design. Can you redesign how that work is allocated? Or do you just need to take that hit and just understand that you will get a return on investment? Any good CPD, any good professional development is at a cost. You know, we just have to recognise that our world has changed. And so when we're doing our workforce modelling now, we do need to build in for those traineeships, those apprenticeships, because that's how you retain staff in today's world. But there is some help, absolutely. The no-brainer is to use the R's to receive the 8K funding. Some practices will even offer out 2.5K for nursing for organising placements. So it's, you know, there is help. And that's kind of what myself and my colleagues in the primary care school are here to support you with, because there's no one answer, there's no one size fits all.
Like everything in primary care at the moment.
Yeah,
thanks, that's really helpful. So I think you've probably touched on this question already. We were going to ask about if you can build in retention clauses into contracts for apprentices. Obviously, number one is invest in them and they'll stay.
yeah.
I get that, but is there a way of building that retention in?
It's a very grey area in law. a very grey area. In apprenticeships, the rules are very clear around you can't ask them, you can't claw back the training fees or any fees that are related to assessment. If you then take it a step out, if you're getting grant funding from the NHSE, you wouldn't obviously be able to claw that stuff back as well. So you have to be very clear in a retention. So if there are costs directly because of backfill cover, that's not impacted on, so you're not utilising ours for that cover, you're not using the 8K for that cover, so it's a direct cost to you. Potentially you could put that into a clause, but you need to be very, very specific on what those costs are. Now, if you're going into 5, 6, 7, 8, 10,000 pounds, who is going to sign that contract? As an HCA, you know, I wouldn't sign it in my role, you know, most people wouldn't. So it is, and then even then, when these clauses have been tested, most of the time it is in the favour of the employee that is left rather than the employer. So if you've got a very good lawyer and you want it, and you really want to push on this retention clause, absolutely do it. Just make sure you're, you know, you've done it in line with what your solicitor says, and I would seek advice on doing that.
Okay.
Yeah, be very clear.
So people are trying to build those in at the minute.
I get it, and I understand it is a lot of investment and time, so I do understand. But what I will say is the evidence on who's actually leaving, it just isn't there. You know, where I've seen people leave, it's, I hate to say it's because they've been dismissed on a few of those. That we've had in Bob, we've had 6 people on the nursing associate who stopped, and can't say for 100%, but you know, more than one of those was because they got dismissed. Otherwise, they are staying. So,
yeah. And I guess you're not picking these people off the street; they're in house already.
Yeah.
You know these people, right? So
yeah,
you're going to pick who's right for you to invest in. So okay, that's really helpful. Kind of taking that step back again to even before you're starting apprenticeships, what are the common barriers you're getting from primary care? You've touched on lots of them already, of people saying, no, I don't want to do this. This is too much. Are there any other things that you're hearing in primary care?
Yeah. So the kind of age old myth around it's just for young people. They'll be coming in making the coffees, right through to, you know, what's the value and the quality, because a lot of, you know, we are of a certain age, most of us, where we saw what apprenticeships used to be like before the reforms, before we talked about quality. And I remember having people with me who had like folders like that big, and there was an assessor that came in and looked at their folder, and you kind of really didn't have much to do with, you showed that, you know, that they did the work, you showed them what to do, but you really weren't interested in actually, are they meeting the skills and competencies and knowledge that they need in terms of their training provider. So I think if you're still carrying that experience with you, if you're from, you know, areas where you were paying minimum wage, or, you know, or you're in an organisation where apprentices weren't treated right, or let's face it, sometimes we can do all that, and we can recruit an apprentice, but maybe our recruitment practice hasn't been as effective as it could be, and we haven't actually recruited motivated individuals. So then you're carrying that baggage. There is a lot there. So I am trying to, this is really, really a great opportunity for me today, because I'm really trying to get that message across. You know, if you put in that time up front to recruit effectively, it does pay dividends. The other side of it is it just appears too difficult, and I won't lie, it can be the first time, because you have to think about those 3 different things that I mentioned. And you know, I mentioned 3 things, but if you really were listening, there's lots of things under those 3 categories. But once you've done it the first time, it then begins to get easier. The other barrier is functional skills. So I think a lot of people in this room will have had experience of people needing to get their maths, particularly, to get onto the programme. I'm seeing people in our healthcare assistant community who've got through life and managed things like dyslexia, but now when they're needing to evidence, it's coming up. and they don't want to admit to it, and I completely understand why that would be. But the shame of it is they're not getting the right help that they need. So they're doing these programs, they're doing the test. Nobody knows about the dyslexia because they might be doing an online course and then they're failing. And so some people are just being put off by it completely, and they're saying, actually, I don't want to do the apprenticeship. And the sad thing is there is actually a lot of support available. So this is one where I would say absolutely come and talk to me, because it shouldn't be a barrier at all. And there are providers locally that will do that face-to-face support, and it's fully funded. So they're not on their own, but that's a definite barrier. And we need to work together to really break that.
Absolutely. And maybe as employers approaching people, if you have that suspicion, asking that question in a curious but kind way, and compassionate, and exploring that from their perspective. Is this a potential barrier, and coming to yourselves to get that support for them? That shouldn't be a barrier. And
in fact, I would almost say, if you can adopt a maths first or a functional skills first strategy, so if you're taking people on, just assessing right from the off, what are their maths and English, have they got the GCSE, whatever, because they may not go on to do an apprenticeship, and that's not what it's about. But actually, if you could just start them down that journey and they've got it and that's ticked, actually it is helpful, isn't it, to be upskilled in maths. I took the functional skills level 1 test and I came out at level 1, which is a grade D for, I think we're all in that, I think, apart from the young ones, you're working in numbers, a grade 4, a level 4. But I'm a grade D at the moment, so I need to upskill because it has changed. It's moved on past 20 years.
That is probably a really good thing for us as employers to be thinking about, right? Actually, maybe I should do the test too and see where I'm at.
Experience
really have that compassion with that person to understand and share that with them. That's a really good suggestion.
Measuring shapes and that.
Takes me back. The trigonometry. So coming on to the next bit. So when you've got onboarded your apprentice, who is normally responsible for line managing and performance managing those apprentices?
So the employment manager, really. So if it's whatever the department is. So if it's nursing associate, be your nurse teams. If it's a healthcare assistant on a senior healthcare support worker apprenticeship, it could be your nursing associate. So it doesn't always have to be your nurse lead. It could be another layer. There's line management responsibility in terms of their welfare, annual leave, all of that. But then there's the mentoring, supervision, that sort of responsibility. And I would say, really, there's no right or wrong on that. It's just literally looking at who it is. If I said to Naga, it's like, who's your line manager? Like, she's doing a senior leader. It's a completely different ball game to somebody who's doing customer service apprenticeship at the manor surgery, where they will need that hands-on support. I'd say the first 3 months, definitely be more involved. Once you're happy that there's a flow and this person's getting the right support, and that individual is in a better place themselves, because they will start learning and they're going to start doing things. Be a bit more creative. We're doing a project in Frimley at the moment. We're recruited trainee general practice assistants who are doing a business admin apprenticeship with a GPA overlay. And in one of those practices, they've actually they've moved one of their business admins into the team leading opportunity. So they're not paying her as a team leader at the moment. She's going to be the apprentice's sort of mentor, line manager. And they've done that in agreement with her to say, look, we're upskilling you, and by the end of the apprenticeship, you will be ready and we'll move you into that kind of a role. So can you use, if you've got a non-clinical, obviously you've got non-clinical teams, can you give somebody a team leading management development opportunity to then manage your apprentice?
That's really good. So don't just think linearly, really think outside the box. Who else have we got in this team? Who else can we upskill and actually give them skills as well, as another opportunity? That's a really good idea.
Yeah, because it keeps hold of them, doesn't it, as well?
Yeah. And we've talked a lot about the money, an awful lot about the money. Thinking about time, how much time is having to be invested by the GP practices for these apprenticeships.
Okay, does anybody know? What's the latest rules around time off for training? Does anyone know? 20%? Yeah. So it is roughly 20%. They just changed it last year to say 6 hours a week. So if they're a part-time employee, this is really important because it will still be 6 hours a week. Okay, so that's an important factor. But the 6 hours a week is kind of depends on the program. So something like nursing associate, registered nurse degree, you've got very clear academic weeks or days of the week, might be 1 or 2 days, might just be block weeks for a period of 2-3 months, say. For somebody who's doing a business admin, customer service, management leadership, digital, that's going to be more flexible. So as long as they've got the equivalent of 6 hours in time to log what they're learning, that's the most important part. So that might look like 1 workshop a month. Okay, so that might be a half a day, might be a whole day. In the other weeks, they'll be doing self-directed learning, but they might also be experiencing something for the first time. So the first time they are responsible for a budget, that's learning. They're having a one-to-one where they're receiving mentoring. So it might be in a scenario with a patient, and then you have that one-to-one and you say, right, how do you think it went? What could we have done better? So reflective supervision, that's learning. Excuse me. They've been delegated something around health and safety risk assessments. That's learning because they're doing it for the first time. So you couldn't do it every time, obviously, but you've really got, again, think creatively, because if then for some reason you need to pull them out of their training time for some reason because it's all hands on deck in the practice, well, they've already clocked their their hours. Exactly. Be mindful of when they're doing their exams and assignments, make sure they've got that prep time. But clinical programs, it's very structured. Non-clinical, it's not so much.
Okay, thanks. That's really helpful and really good idea to, again, think outside the box and log those and get those in.
Yeah, that'd be my middle name, Kush, think outside the box.
Again, we've touched on this with a couple of comments there other people have done around maternity leave, paternity leave, annual leave. Are there clauses in these apprenticeships? It sounds like you can pause them and things.
Absolutely, yeah. So once they're over 4 weeks of absence, you pause them. Yeah, and then when they're ready to return, you pick them up. It can, if they're on a degree program, for example, there are set modules by the university, so we have to have a conversation around at which point do we pick them up. You know, what do we, if obviously we know they're pregnant, so what do we do before they go off and leave to help them when they come back? So in Amy's example, her employee is coming back on placements. She just needs to finish the placements. I believe the modules and assignments are pretty much were done before she went on leave. If a person is being made redundant for any reason, they can pick up their apprenticeship where they left off as long as they've got another employment, but they have that right to continue and work with the same provider. Yeah, I think that answers the question.
So there's a little bit of flex there. So it works on that individual of what does this person need with their potential pregnancy, maternity. That's really good.
What I will say, the 6 hours of the job training, that should work around annual leave and sickness. So it's not, if they were on annual leave for a week, they don't then do 12 hours in the next week.
Yeah. Okay. It's not accruing.
It's not accruing, so it's still 6 hours have their annual leave. Because and again on that point, you know, we are in the driving seat. So when the apprenticeship reforms happened in 2017, it happened because businesses were moaning about the quality of apprenticeships. So the government said, you as employers are in the driving seat of apprenticeships. So if you question the provider, because actually you're the one who should be driving and saying, actually, I want them to do this project. I want them to learn this. We shouldn't leave it all to the training provider. So that's where I'd really like to get into those conversations. So
any ideas on how you would facilitate those kind of conversations?
Usually it's right at the beginning. So if it's about what's the design of this training program, what they're going to learn, those conversations need to be happening at the beginning, at the training plan. So most providers will say, this is our program, this is what it looks like. But if you've got that know-how, you say, actually, no, in our PCN, this is what we're doing in the future. This is how I want to shape the skills. And you can argue that for nursing associate, you know, kind of in terms of research projects and things like that. On the technical things like off the job hours, annual leave, sickness, just come to me at the moment. I'm around. But if I'm not, you know, there are lots and lots of resources available. So the healthcare, HASO, can't remember what it stands for, Healthcare Apprenticeships website. They've got lots of one-page guidance toolkits. They've got a primary care tab. So you go on there, and honestly, it's so useful. So, you know, you can help sort of navigate some of these questions. But if you're not sure and you just want to double check something, just ask us. Yeah.
And my last question really is, have you got any, and this might actually open up to the room, have you got any examples, really positive examples of apprenticeships lately that you've seen that have really sort of make you think this is exactly what apprenticeships are about?
So we had in Oxfordshire an Apprentice of the Year winner this year. So she's from Woodstock Surgery. So if anyone knows Fiona Jeffries, her name's Ceres Macy, I think. And so she was recruited just before COVID, I believe, and she was really instrumental in helping around the whole vaccines program. You're nodding your head. Are you linked? Yeah. Oh, amazing. Yeah. Okay. Do you want it? Were you part of that journey? Is there anything you can say?
No, not.
Yeah. All right. Fair enough. Yeah. And so I sort of put out there that these awards are available, and she submitted. And when you look at the backstory, it's amazing. She did way above her pay packet, you know, and she's been there, I think, nearly over 2 years at least. So that's a really fantastic story. I have the wonderful Linda here in front of us, you know, who's taken on, she's 4 apprentices, but you've done them in the past, haven't you? So 3 at the moment, but she had Jack, who's business admin, who got a distinction. And you know what? He's left. So Lynn's going, why are you looking at this example? Because he left. But, you know, he's left to kind of, is he within private? Or did he go into insurance? I can't remember.
Insurance.
Yeah.
He did actually come back and
exactly. Yeah, so it's for the greater good of the all here as well. It's, you know, we can't just be inward focused in everything that we do. We do need to have a supply chain out into wider health and social care, or like voluntary in your case. But what Linda's doing is, you've done apprenticeships before, so your first lot, but she's got a nurse degree apprentice in collaboration with Royal Berkshire Hospital. A person who's on a practice manager who's on a senior leader program, and a finance manager who's doing the operations manager program. So upskilling her internal workforce. So I think that's a fantastic example. And then over in Bucks, we've got Sarah Moore, who came in as an HCA from social care background into, I can't remember what practice in Berrycroft, I'm not sure. They trained her up as a nursing associate apprentice. She's completed that. Did a bit of consolidation, was doing cervical cytology, you know, some sort of those more advanced skills, and has nearly finished the registered nurse degree apprenticeship. So she's the first one. And, you know, I think they are success stories, because in every case, every example, the PCN practice has taken a risk and taken a chance on that individual, which has opened doors for so many more practices. And when I look around the room, actually a lot of you are engaged in apprentices. So where I started at 2 years ago, we're on a scale of 1 to 5, we were literally at -2 with apprenticeships. When I look around the room, I'm like, there's so many more of you who are doing it. So yeah, so I think we're just a successful area in apprenticeships.
I'm sure it's hugely down to you.
Yeah, no, it's not.
Amazing. So that's the end of my questions for you. Do you want to open it up to the room? Oh, that's
She's not allowed.
Go for it.
What about the wider workforce? Are there apprentices in the AHP?
Should have known. She's going to beat me up later on for not mentioning. Absolutely, there is. Absolutely. So if we think about paramedics, physiotherapists, occupational therapists, dietitians, there's, you know, for how many AHP roles are there altogether? About 14.
14?
Oh my God, I am on form today. Okay, there's pretty much an apprenticeship for all of those pathways, even podiatrist. I guess the challenge we've got at the moment is we are growing that workforce in primary care. And I hope that continues to expand. I know we've got challenges with DES and Rs and everything, but it makes sense for us to employ those roles. As that we increase that workforce and we have that supervision capacity, we absolutely need to be looking at our assistant practitioner community and our senior healthcare support workers. Because at the moment, you know, if I say those two roles, we think nursing, but actually we need to be thinking the other way as well. So health education, England, when they were here, they did a lot of work around the assistant practitioner apprenticeships and having specific pathways. I can't remember what those pathways are at the moment. We've got some that are already sort of running. Occupational therapy is one of them. So potentially you could have somebody in your workforce now who is interested in becoming an OT. You could put them on the assistant practitioner pathway where there isn't as big an ask on placements. What you need is very good supervision. But if you think about OT and the different fields, so as an assistant practitioner, they won't need to go and do all of the different placements like they would on the full degree. But you still would want to give them exposure. People always ask about paramedic. That is a bit more challenging because they need to get their ambulance driving and certain other things. But I'm always open to having that creative conversation with the wider system. But I need PCNs that would seriously entertain that because it would mean a lot of placement rotations. But it's definitely the goals. It's definitely there. And as we move away from nursing, because I think we've kind of established that one, we do need to start exploring. Physician associate is the other one. I mean, the funding will come out again, so there will be 10k worth of funding more than likely. I don't know if it will be exactly 10k, but there will be substantial funding linked to that. And so, you know, thinking about your local communities, could you recruit people from your local communities into these roles? Because as the doctor's degree apprenticeship gets more established, could that be a pathway? And then that would be amazing. And Abby and I were having a conversation with, is it Queen Mary's or one of the universities, and we were saying actually the traditional model of when they do a degree, they have lots of acute placements, don't they? Well, actually, we can do a lot more in primary care. So do they need as much? No, they don't. So yeah, physician associate is the other one. Doctor's degree will be coming, allied health professionals. Yeah, and that covers a lot of them. Good question, Sue.
I've got two questions. Okay. So I'm thinking along the lines of our work to develop PCN learning environments.
Yes.
Which I know the majority of you are involved in. So my first question is, what opportunities does PCN learning environment give to the use of apprenticeships to develop staff? Question one. And question two is about money. So thinking about the non-recurrent funding that we're using at the moment to support workforce support lead roles and the development of PCN learning environments, thinking about the apprenticeship money that comes with the apprentices, is there any opportunity there to cycle that money into the workforce development lead roles to make them sustainable in the longer term?
It's a good question. So to take the second question first, with the levy transfers, that is very specifically to pay the training provider, so we can't touch that funding. But I guess where we're talking about additional grants like the 8k on the nursing associate, on the face of it, it would seem like a difficult conversation to have because people are using it for their backfill costs. But actually, probably need to have several conversations to try to navigate what that would look like. It's up to the PCNs and the GP practice, how they use that funding. It's not ring fenced for anything in particular. It's not ring fenced for backfill cover. So I think it's a conversation that we should navigate. I guess in return, the question is, you know, how are workforce support leads going to be involved in that? And actually, if the PCN learning environments are supporting the placement coordination, haven't got all the answers right now, but I think, yeah, we should certainly ask a question. But in terms of the levy transfer, unfortunately, that is very much, it pays for the training costs. In terms of the PCN learning environments and their role with apprenticeships, in my mind, I think it's a no-brainer, really. I just think if you're looking at your clinical programs, you'll be looking at, you know, obviously all different types of placements, and you'll be looking at your nursing apprentice placements, your physician associates when they come down the line next year. You'll be looking at that anyway. But why not look at your non-clinical apprenticeships as well? But think about not just bringing in a new workforce, think about your existing workforce as well. But in terms of, if we think about what the environments are there to do, it is about giving that richness of experience. So I would say, even if they're on a non-clinical apprenticeship program, can you build in a little bit of rotation there? So if you're doing rotations on your clinical placements, so they're going out to nursing homes, pharmacists, you know, whatever you're building in, why can't a non-clinical person do that as well? It doesn't need to be as onerous as, you know, placements. I'm talking about shadowing days, but it gives them that understanding of, when I'm talking to that pharmacist, actually, what does it look like for them? What does it feel like? Does that answer the question, Sue? Yeah, okay, good. I think it's an exciting time for PCN learning environments. The other thing linked to that is your T levels and your traineeships. T levels, there is funding attached to the supervision of a T level student. Local colleges, they are desperately looking for placements for their first and second year, adult nursing, digital, business admin, and there's supervision funding up to £1,000 attached to this. So again, as a PCN learning environment, you might want to explore that as well.
Thank you so much for sharing all that knowledge. I hope everyone will join me in saying thank you so much for your time, because it's been fantastic. So yeah.